everyone, and thank you so much for joining us today. My name is Jordan Huckabee, and today I'm here with Dr. Nick Miller to go over some different topics about diabetes. This is something that we get asked all the time, and so we want to address some of these concerns and top questions that you have. It's going to be quick, informative, so I hope you learn a lot from this. I'll go ahead and get started. One of the first questions that I want to talk about is basically, why is this a conversation? Why is this something that we see so much today, and people researching and Googling and asking, you as a pharmacist questions about diabetes right now?
It is one of the most common questions that we get. I think that it has a lot to do with, maybe taking a step back. Diabetes is generally considered, type 2 diabetes at least, is generally considered a lifestyle disease, okay? And so doctors will say that it's patients' choices and dietary habits that lead to the progression of diabetes. And diabetes really is just the inability of the body to manage its own blood sugar levels. So a lot of the viewers out there have probably heard of insulin. That's one of the hormones that your pancreas secretes to help bring your blood sugar down low. And I kind of like to oversimplify things sometimes. If we keep hammering our body by taking in more and more sugar than we actually need, it's like the insulin that our pancreas is secreting doesn't really work as well as it's supposed to. We get resistant to the effects of insulin. And so over time, your blood sugar creeps up higher and higher and higher. And so one of the things that kind of goes hand in hand with that too is we have it's really an epidemic of obesity in our country. And I think that that's something with the CDC figures in 2016 was the most recent time they did it. I think it's around 40% of the country actually has obesity and obese BMI. And it also disproportionately affects our minority populations too. So subsequently, you have diabetes rates are much, much higher in patients with obesity. The two things kind of go hand in hand. And diabetes also disproportionately increases our minority populations too. So we get a ton of patients who come in and who are asking about diabetes, whether they're kind of in the early stages, they call that pre-diabetes, or whether they've actually been diagnosed, looking for ways that they can kind of reverse the course or change the course. And the good thing about it is there are some ways that you can do that. But I think really to answer your question, it's primarily just because the prevalence is so high. It's something, if the patient themselves does not have diabetes, they more than likely have a family member or someone close to them who is struggling with it.
Well, you brought up a really great point about pre-diabetes as well. And actually, on this next question, I was going to go over that I saw a statistic that said that a third of Americans actually have pre-diabetes. So, are there any lifestyle tips or, ways that they can prevent potentially or reverse pre-diabetes as well?
Yep. So that's a really good question. And I think really the best way to address it is kind of explaining what pre-diabetes is. And so diabetes, like I mentioned, is kind of the body's inability to manage blood sugar appropriately. So pre-diabetes is you're kind of trending in that direction. And there's some blood tests that your doctor can do. You can even, do a finger stick at a health fair locally and figure out what your blood glucose is. But there's two things that your doctor really looks at. They kind of look at your fasting blood sugar, and then they also look at what's called your hemoglobin A1C, which is just the trend of your blood sugar over time, kind of over a 3 or 4 month period. And so you can get information very easily through just regular routine blood work at your doctor. And I think that kind of knowing is one of the first steps. And you may have uncovered the fact that you're pre-diabetic at your doctor's office, or you may have gone to, a health fair or a local pharmacy and had, a finger stick done. But pre-diabetes is kind of you're in this window. Your glucose is a little bit higher than it should. Your A1C is kind of trending in the wrong direction. So I think kind of knowing you're in that stage is first and foremost the most important thing. I would also say that in someone with pre-diabetes and really type 2 diabetes in general, the beautiful thing about it is it's reversible. So since it's a lifestyle type disease, you actually can, and we see patients who are able to do it all the time. You can reverse it. Mm-hmm. We've had patients who have had rampant diabetes. Their sugars are in the 300s, which is like triple what someone's normally would be. Actually been able to institute lifestyle changes, maybe do some supplementation, maybe they're on prescription medication, get back to where their body's actually able to manage their blood sugar effectively. So to answer your question, really with anything, and as a pharmacist, it may sound funny for me to say this, but really the best way to handle a lot of these sorts of things is not necessarily medication on its own. It's always going to be lifestyle changes. And so if you come into our pharmacy and I get to have a conversation with you, that's really going to be one of the first things we talk about, or what are some easy things that we can do day to day to help control our sugar. Number one, learning how to read a nutrition label. Super, super important and pretty straightforward. That's kind of a topic for a whole nother video. But I tell people, you've got 3 different ways that your body can get energy. You got protein, fat, and carbohydrates. And so carbohydrates, that's the sugar. That's the one we're concerned about with prediabetes. So just bringing that carbohydrate consumption down, it's really being mindful of it is really the first step. Lifestyle would also be something like taking a walk after dinner. That's something my wife and I have kind of gotten in the habit of doing with everything that's been going on. You eat your dinner, you go out for a walk after. That allows your body. People who do some exercise, even if it's something simple like walking around the neighborhood, those people have less insulin resistance than people that don't. And so that's something really easy that you can do. And like I said, you don't have to go out and run a marathon or anything like that. It could just be getting up and moving. So being mindful of the labels, decreasing your consumption. And I would also say, the exercise is really, really easy. Another really kind of simple thing is don't mix, as far as diet goes, don't mix 2 different types of carbohydrates together. And so I'm not someone I don't like to get on a soapbox and preach at people. If you want to have spaghetti and meatballs, fine, have spaghetti and meatballs. But know that the garlic bread that you're having with it, that is sugar as well. And so if you're going to do that, by all means do so, but everything in moderation and, maybe just commit to one type of carbohydrate per meal. So in someone who's pre-diabetic, little changes like that made 3 meals a day over the course of a few months, it really can add up. And you couple that with some physical activity, you can reverse it without any medication.
Awesome. No, thank you for that. That's a wonderful, wonderful tip. I know in there you mentioned also supplementation. And I know that one of the supplements that you recommend and that a lot of our pharmacists recommend when looking at diabetes, prediabetes, or even just patients trying to lose a little bit of weight is the pro-glucose support. And so I know that that's been mentioned, but I wanted you to go into a little bit of detail about why these certain formulas, what's in this product that makes this effective for diabetes.
So if you were to get online and type in, best supplements for diabetes, probably the first thing that comes up is chromium. And chromium is really good at regulating blood sugar. It also can help some with carbohydrate cravings. And so chromium, I think, is a mainstay of anyone who's looking to address blood sugar control on their own. So I think you have to have chromium in there. But there's also kind of another little known element called vanadium that kind of has similar type activities. It almost kind of mimics the activity of insulin in the body. And so that can be really beneficial if your body is not responding to the insulin that you're producing on its own. So I like the pro-glucose support because you have the chromium and the vanadium together. And then just in general, kind of for patients with prediabetes and then some who are maybe have type 2 diabetes diagnosed, alpha lipoic acid is really important as well. It's a very strong antioxidant. And one of the big things that high blood sugar does to you over time is you really can get some damage to your blood vessels, especially in your extremities. So if someone watching maybe has family member with diabetic neuropathy is kind of the worst case scenario where they have tingling in their fingers and toes and temperature sensitivities and things like that. The alpha lipoic acid is really, really good for kind of helping that blood to flow through the capillaries and the extremities. So I like that. It also has some roles in managing the blood sugar as well. I think the product also has some biotin in it. Biotin is a B vitamin. B vitamins are responsible for helping us to kind of change our food into energy. So the Pro Glucose Support makes it really simple since it's all in one together.
Thank you so much. This is a ton of information that's very valuable, I know, to our patients. So you've gone over so much great information, but I know that every patient is so different, and each, prescription that we're doing here is customized to them. So I do want to make sure to mention that, you do these consultations on I feel like I've been the patient right now, but we have these to be one-on-one where you can actually, like you said, sit and talk with the patient about their lifestyle choices and just little pieces that's individual to them, because we live different lives. We've got different stress levels, and work from home has been, I know, a really, really big one for people, going and reaching in their cabinet all the time. So tips and tricks on that too. So I do want to mention and kind of finish this up by saying, if any patients are out there looking for more tips and tricks from a pharmacist perspective as well, and looking at medications and really analyzing that on a different level, then we do offer consultations all day long. So if you have questions, please give us a call, and I know Nick would be happy to discuss this further with you.
Yep.
I hope this is wonderful for all of you patients out there watching, and hope it was a good education piece. So thank you, Nick.
Yep. Thank you.